Notice when you go to put the gait belt on, notice that there's teeth here. Okay? You put through the side with the teeth first, and then the smooth side. Okay? And you pull it tight. Lift up on the pit. I can't remember. I mean, I've heard it so much. Lift up from the buckle when you're on the airplane. I should know it by heart. Okay, so I'm going to tell you the story of gait belts. Okay, I'm not a big fan of gait belts, but legally, if a patient has a gait belt on and they fall, let's say a patient. Take that back. Okay, let's say the patient doesn't have a gait belt on and they fall while I'm doing a transfer or I'm gait training them. I am considered negligent because they don't have a gait belt on. Whether I go to grab it or not, I'm considered negligent. Okay? So we put gait belts on our patients and we can use them. But in this class, since it's my class, we will not be heave-hoeing on the gait belt like this to move the patient. Your book talks a little bit about that. Okay? But if you do that during the practical, you'll be doing it again. Okay? Without that maneuver. Okay? So, to me, that is a no-no. And these are my reasons why you don't yank the patient up or lift the patient up by the gait belt. Have you ever heard of skin tears? Especially grandma. As people get older, they lose the cushioning layer of fat underneath the skin. And so that makes the skin a lot more fragile. Also, the skin is drier, so it's also more likely to tear. And a skin tear is often the beginning of a pressure sore. Okay, so we don't want that to happen. And then if you add in the fact that the patient's probably taking anticoagulants because they have high cholesterol, they're going to bleed a lot. Okay, so we don't want to do that. And think about where the gait belt is often placed. Okay, so you're in a hospital and you go to the cafeteria for lunch. You can point out who are the PTs and the OTs, and how can you do that?
You have healthier meal choices.
I so wish that, but no. They all wear gait belts around their neck, around their waist. And you know, oh, that's a PT, that's an OT, because they wear their gait belts, okay, especially in acute care. Okay, but where we put the gait belt on the patient, sometimes you'll see them put the gait belt on the patient right underneath the armpits. What's in the axilla?
No.
The brachial plexus. Do you want to put compression on the brachial plexus? No. So, not a big fan. Also, underneath the breasts, especially as women get older, if you yank up on the gait belt, where might that patient have a skin tear or a pressure sore? Underneath the breast. Not good. Okay? So, not good. We usually put it around the waist. I'm okay with it around the waist. But really where the action is, where we have the most control of the patient, is in the pelvis. We don't wear the gait belt around the pelvis. Okay? So, I'm not a big fan of the gait belt. Dr. Mitchell is not a big fan of the gait belt. And you'll hear about it in class. So, when she says that, you can go, we already heard that. I beat her to it.